platform gebaseerd op de blockchain. Hij zal straks meer over vertellen. Ik ben David tegengekomen in Barcelona. En had een heel fantastisch verhaal. Hij zei dat er meer dan 100 miljard wordt verspild in Amerika om medical care. Hij zei het is heel erg zonde. En Solve.Care heeft een oplossing ervoor. En ik wil jullie uiteraard van harte welkom heten. Ik zie bekende namen ook. Anja Smits, Kees Ruijten, Kees van der Sluis, Luc van Eetveld. Mark Brouwer, Palmira, ook leuk dat je bent. Pien Nelis natuurlijk. Kees Ruiter, Mark Brouwer. En Leon Piels, die komt straks nog binnen. Ja, komt net binnen. Ik switch over naar Engels, want ik heb David Randall bereid gevonden om een verhaal te houden over zijn propositie. Luister goed naar zijn verhaal, misschien vind je het interessant en doe ook gewoon ideeën op. So David Randall, thanks very much for having you in this webinar, especially for our Dutch CryptoAcademy community members. And people are already applauding virtually for you. And I did a short presentation or short introduction about you, but please go ahead. The floor is yours, David.
Jean, thank you very much. My pleasure to speak with your colleagues in the Netherlands. So what I'd like to do today is to tell you about our ICO project and the company and what we're all about and our vision in terms of using blockchain technology and applying it in the healthcare sector. So by way of my background, very quickly, I'm an academic researcher, and I've spent most of my career looking at health information technology, healthcare entitlement systems, the administration of healthcare, and all the various things that go into it. So I think I have a deep knowledge in terms of my professional experience with it, and that's one of the reasons why I have agreed to serve on the board of Solve.Care and to serve as a senior policy advisor for the company. So what we will discuss today. So we'll discuss some of the challenges in the current healthcare environment, which I think are fairly well known around the world and of course especially in the US, and discuss why healthcare payments are so complex and how an intelligent digital currency utilizing blockchain technology can help redefine administration and payments. So in short, as I think most everyone on the call should know, that healthcare payments in the US, as a prime example, are an enormous expenditure of gross domestic product and continuing to rise. Right now, we spend a little over $3.2 trillion a year on healthcare, with most of that going towards entitlements, meaning Medicare and Medicaid, the two government-run programs that are run by the federal government and the U.S. states. Money is spent similar around the world on hospital care and physician services. That's the majority of the spend, as you can clearly see. And then, of course, prescription drugs and the various other ancillary provider services within the system. Fundamentally, the third-party payment model, meaning utilizing health insurance, is fundamentally complex. All sorts of verifications of services, eligibility, pricing, cost sharings, discounts, exceptions within the system, as well as payment to multiple parties within the system. The healthcare payments life cycle is incredibly long in terms of these multiple payment methodologies that are multiple views and adjustments. So some of my academic research in peer-reviewed publications has focused on looking at fraud within the system. So as a prime example, one paper that I co-authored last year with my colleagues shows that close to 20% of spending is directly attributable to waste, fraud, and abuse within the U.S. Medicaid program, and that amounts to roughly $100 billion that we estimate based upon claims data analysis that we performed. That, I think, gets to the heart of what blockchain can achieve and what our company is all about in terms of utilizing blockchain to specifically address waste, fraud, and abuse.
David?
Yes, go ahead. I'll continue if you'd like, unless somebody has a question.
No questions so far, David. Go ahead.
Okay, great. So, I think the problems are well documented, so the question is, what can we do to improve things? So, a smart healthcare currency that we're advocating can fundamentally help to coordinate much better, infinitely better, all of the issues that I've just outlined. So that includes automatic adjudication, escrow payments that are made timely, proof of service, proof of payment, proof of pricing, as well as audit consent, all of which are very cumbersome in the current system. So our intelligent currency will, in essence, have a much better to use a distributed ledger that, of course, blockchain is built upon. This will be a relationship-centric payment model. It will define and encapsulate payment relationships between the parties. So those are some of the examples, some of the prime examples, between insurer and insured, between patient and doctor, doctor and insurance entity, specialist and a doctor, and employer and employee. So the currency can evaluate these relationships in real time, as opposed to, as an example, in terms of payment adjudication and payment proof, the fundamental nature of those systems today in the U.S. healthcare system, and I would argue in almost any system that I've examined, it's usually pay and then chase, meaning if there's a mistake made, regulators, insurance companies, governments, it takes a long time to figure out if something was done wrong. The blockchain can fundamentally change that relationship. In terms of evaluating these relationships in real time, directly related to eligibility, pricing, medical necessity, the relationships I just defined, as well as proof of payment. So we can have verification and enforcement using currency, not systems. A currency that's programmable, that we're advocating, can enforce these relationships through verification at point of service rather than after the fact, proof of service, a real-time commitment to pay, an agreement within a smart contract to allow third-party review and automatic adjustments. Proof of service-based billing is continuously computed using these metrics based upon events such as scheduling, consent, diagnosis, prescription, labs, referrals, and follow-ups. Different programs and stakeholders can compute it differently, such as we've just discussed, insurance, patient, employer, as well as government agencies. Different programs and stakeholders can compute it differently. Obviously, the insurance company can use proof of service in conjunction with billing regimens and evaluating healthcare payments based upon level of proof, not amount, and relationship, not episode. And that's a fundamental, I would argue, a paradigm shift versus how payment and administration of healthcare is achieved today. So escrow-based payments. Third-party payment administration can fundamentally be replaced with direct payments and third-party review. Escrow payments for commitments to pay upon proof of service between all the relationships that we've just outlined. So summary of the key characteristics of our platform and very specifically our digital currency. The currency itself will have a stable monetary value, meaning that the coin that is tokenized within the system, it's different from the token that we're offering for sale for our ICO, is stable. It's guaranteed. It allows for proof of service. It allows for adjustable administration of cost bands. It provides, of course, through the blockchain an immutable audit trail. It allows access control, meaning privacy and personal health information is protected. And it allows for automatic escrow. So this currency has the ability to coordinate all of these complex aspects of the healthcare system as it is today. And we argue that many administrative systems can be streamlined and made much more efficient through the deployment of our technology platform. So we're building this platform in CARE.coin, the intelligent currency, to achieve this goal. The platform has, in short, a mission to reduce non-care costs from 30% to 3%, to decentralize healthcare and benefits administration, to engage and empower the patient, to reduce, obviously, administrative burden, to ensure accuracy, and something that I'm fairly passionate about in terms of making fraud, waste, and abuse very difficult, if not impossible, through the deployment of the blockchain. And equally as important, to bring transparency and accountability to the entire payment lifecycle. So our mission, pure and simple, is to revolutionize the biggest part of the U.S. economy and, of course, healthcare systems around the world through this new approach. So that includes my overview. I'd like to sort of break here for any questions that people have before I go to the next deck that provides a deeper dive into the platform as well as what we think is our revenue potential. So
Yeah,
Dan,
well, yeah, I will inventorize a little bit of the questions already, or otherwise I will put some questions in front of your feet today. What you told about very much costs are made in necessary in the healthcare system and also in the United States. And with your solution, you are saying about more than 3%, maybe 20% is you can also help to reduce the cost. In terms of billions, or in the monetary way, how many billions are you talking about potentially?
well, in short, our platform can be deployed within a government agency, within a hospital system, with physician practices, and of course within an insurance entity or company. And from our perspective, in terms of the platform, and we have developed prototypes thus far in terms of everything that I've described to you, the approach can be modular and incremental, meaning we don't have to disrupt existing systems. We can, in essence, use our platform within subsystems to make them more efficient and then deploy them out in terms of utilizing them. We suggest and we argue, and we've got another document forthcoming which in essence fully lays out our revenue model and revenue path, that within a few years we can grow our revenue close to $1 billion, we think, based upon replacing existing systems with our platform, and we believe that we'll be able to clearly demonstrate the cost efficiency and savings of this type of platform built on blockchain technology.
Okay, I got a question of Kees de Ruiter. Welcome, Kees, to the webinar. Case is asking if there's already a project or small project running already based on your Solve.Care platform.
Yes, we have a prototype developed. We're not ready to announce yet, but we have several organizations and entities that are going to be developing um, pilot projects with us, in essence, as proof of concept to deploy various aspects of the technology so that we can, in essence, demonstrate how it can work. In addition to that, I'm involved in discussions with several state Medicaid agencies to deploy fraud analytics, which blockchain can be built upon, which is another application. So the point that I'm making is that there are literally hundreds of applications that can be developed through our platform and more specifically through our CARE community of developers that we're recruiting right now in terms of the deployment of the technology.
Okay, we'll take a look if there are other questions. If not, we can move on to your other part of the presentation. Oh, wait, there's a very long, I don't know, do you actually read on the left bottom? Can you also read the questions of the people?
Yes, I can. I can see by Mr. Nellis.
Yeah. Could you repeat the
Okay.
question, please?
Yes, I'll repeat in English, obviously. I like the idea, but see the added value. But do you think that transferring the full fee-for-service system from care institutes to a blockchain is realistic in terms of implementation? HIT systems are uh, are by definition hugely centralized. I have difficulty seeing that migrate to a decentralized technology like a distributed ledger. Very valid point. Um, so with that in mind, yes, many of these systems are data siloed systems. Um, many states, as an example, as does CMS that runs Medicare, as do most insurance companies, don't have just one centralized system. They have multiple centralized systems that do multiple tasks. So our approach to this is that we can, in essence, take off and apply our technology to systems to demonstrate their efficiency and efficacy by, in essence, using the technology in conjunction with these centralized systems as they currently exist. The beauty of blockchain and what we're suggesting here is that the migration as well as implementation will be, in my judgment, a lot simpler than, in essence, replacement of these large centralized systems that take years and literally hundreds of millions of dollars in the case of Medicaid and Medicare for that matter to change. And blockchain can be done in this incremental fashion. And I think that is, in our judgment, the path to implementation in terms of dealing with existing systems technology.
Pete, is this satisfying for you? I think it's a very good point, of course, and I think that's very, yeah, very clear. Yeah, sure. The future will tell. Wise words. If there are not any more questions, we can move on to the other part. Please
Sure,
go ahead.
I will. Thank you. So this deck, I think, will provide additional detail in terms of what I've discussed thus far. So our platform fundamentally is an ecosystem and marketplace for community and clients to leverage these systems. As I think I've argued, centralized systems cannot serve increasingly segmented healthcare markets. I can go into the failures of many centralized systems that governments have deployed, or for that matter, even some insured. We fundamentally argue, fundamental mission of the company, that distributed ledger technology represents a way to redefine these relationships. We're building a global platform with local applications. So we've got, I think, compelling immediate use cases for implementing um, the many aspects of the system that I've outlined. So in essence, we've got a B2B revenue model with B2B and business to consumer applications. And based upon our modeling, we will be cash flow positive by the end of 2018. And we argue, and based upon some of the initial data that we've modeled, the ROI for clients is literally immediately. It's finite and it's compelling to go from administrative costs from $120 to $12 per member per month. Secondly, obviously, CAN, the Care Administration Network, that's our token, is the utility token of the Solve.Care platform. This token, an economic model, again, all on the website, incentivizes diverse processors and consumers to utilize it. Our management team has 25 plus years in health IT administration and policy. Again, the bios, as well as the experience of the key management personnel is all on the website as well. We've got a very deep advisory board, most notably former Congressman Jim Moran, the former Secretary of Technology for the state of Virginia, Don Upson, the former state Medicaid director, and Karen Rowling, to name just a few. And we've got another individual who's well known in federal government information technology circles, that being Paul Brubaker, who served as acting Chief Information Officer for the Department of Defense at the Pentagon. So, I think we've got a very credible team, and I would argue mission. Our token sale threshold for development of the initial platform is 25 million. Our hard cap is 257 million. So we've already talked about healthcare costs, so that's somewhat repetitive. So I think everybody knows that story. So fraud, waste, and abuse. I'll take a moment to talk about this because this is, I think, one of many use applications and use cases that we will be developing. Fraud fundamentally across all healthcare systems in terms of its detection, is pay and chase, meaning centralized systems are really poorly equipped to deal with issues of fraud. So what I've done with some of my colleagues is that we've done studies and several peer-reviewed papers in academic journals examining claims data by using predictive algorithms that provide our own proprietary scoring technology and application through these models that detect fraud in a much, much better way than can currently be done. We would argue that by deploying and the use of these algorithms within a blockchain can really substantially limit and reduce fraud, waste, and abuse. That's certainly one of the first use cases that I think we're going to deploy. So centralized systems, as I think I've mentioned, silos of data, and there's a lot of duplication. In essence, siloed data models and methods lead to, I would argue, frustration, as does the third-party payment model. And we've got tremendous disintermediation of the individual within the system. So all of this, I think, argues for more of a decentralized system, fundamental to blockchain, that we think that will allow greater coordination between all the parties within the healthcare system and to reduce, in essence, the friction and cost within the system because stakeholders fundamentally are out of sync with one another. Centralized systems, silo data, um, and, and fundamentally add to this waste and abuse within the system. So I've already gone through part of our mission, so this is somewhat duplicate, but in short, we believe that our platform can help solve many of the problems that are inherent in the system use of the blockchain. So our platform is composed of these key components that all, in essence, work and sync together on a blockchain. CARE Wallet, the CARE Card, CARE.MARKETPLACE, CARE Coins, which is again the programmable token for the platform itself, the CARE Vault, and the CARE Protocol. We take on a relationship approach to healthcare. Again, this is fundamentally available to us because of the blockchain in terms of the relationships that I've already outlined. So the CARE Wallet is your personal healthcare coordinator. Holds all your information, CARE cards, and CARE coins. Helps to automate scheduling, consent records, discounts, verifications, and payments. Automatically downloads these cards relevant to your needs, and these wallets automatically keep you and others in sync. We have built this prototype, and we should be placing a video on the site in terms of the ability to see this actually in action. The CARE card is an intelligent application that is downloaded from the marketplace. And this, of course, delivers real-time information and control to the wallet holder. It provides automatic synchronization of cards in your wallet and others. It's easily stacked, grouped, and linked with other cards. It inherits the intelligence of the CARE wallet and the protocol pair, and has two sides of data, public and private. That's very important to note because in all healthcare systems, especially in the US and I know in the EU as well, health data privacy is a major concern of government, of course, of individuals as well. This requires no centralized system. CARE protocol keeps everybody in sync. The CARE marketplace gives clients options, gives clients access to apps and services, meaning all of the use cases that we've outlined, and I think that will eventually be outlined, can be developed in this CARE.marketplace in terms of providing um, uh, through integration as well as very specific applications through these programmable um, tokens and protocols that I've outlined. The CARE.community, which is in essence our developer platform, is actively managed and supported by dedicated community managers, and there's obviously a reward system to create participation and innovation. So the platform is really for everybody. These are all the potential users of it. Obviously, individuals and families, doctors and care providers, hospitals, labs, and pharmacies, employers and administrators, insurers, government agencies, developers and professional service providers, of course, economy overall. Clients that we've just outlined can configure their care administration networks the way that they see fit, the way that works for them. And it can be configured within platforms to provide this synchronization. This fundamentally eliminates expensive systems data centers, integration projects, and teams because of the decentralized nature of the platform. Network topology, different programs. So spend a lot of time just talking about this particular slide. But in short, for any type of insurance entity, and as you may know, there are literally hundreds of different types of insurance entities in the U.S. alone, depending on the payment system or where you're at. So this network can be configured to deal with it. Centralized systems fundamentally have a difficult time dealing with changes. And we argue that this type of administration network that we're building through our care administration network can be configured a lot easier, a lot less expensive than many of these current systems. So what makes us different? Obviously, we think that our system can be of tremendous benefit to all the stakeholders involved in terms of reduction of cost, and be benefit and used by all the stakeholders within the system. We've got a pure experience and proven team. We can show immediate ROI for anybody that uses the platform. One of my fundamental missions related to this, rather than us deploying it and just letting us go to it, we want to measure effectiveness. As an academic researcher, that's important to me. And I'm recruiting other academics to, in essence, to measure and to make certain that the system is functioning as we believe it should and will, and more importantly, to provide data to potential clients about its efficiency and efficacy.
David?
Yes, go ahead, please.
Yeah, I got several quite interesting questions. First, an easy one from Palmira Bakker. How user-friendly will your application be for the user? And presumably for the patients, actually.
The prototype that we've developed is, I would argue, incredibly easy. We've had lay people test it, meaning using a smartphone, and it's incredibly easy to use. I would argue much more so than current interfaces that many healthcare systems and insurers are utilizing. And more importantly, it will provide a lot more functionality in terms of these systems all working together. So we are in the process of putting a video up on our site that shows this interface, this prototype that we've developed, actually in use.
Okay, clear. And another question is of Pinellas. He says, I presume that you will build on Ethereum and deploy smart contracts, or will it be a permissioned blockchain?
No, currently, very good question. Currently, we're building on Ethereum, and our goal eventually is to develop our own blockchain. Now, anybody that's obviously keen and understands blockchain technology, as I've certainly become schooled in the last few months, knows that Ethereum in particular would potentially have problems scaling to the volume and number of transactions that would be associated with the healthcare industry. Now, what I have learned is that there are a whole host of other blockchain startups that are attempting to address this issue of network scalability. So I think that that is a problem that can be solved, but the short answer is that we will build on Ethereum. We are building on Ethereum right now, and we will eventually transition to our own blockchain.
Okay, perfect. And another question of Case Router following the previous question. I think it suits very well. He states, is it, for instance, possible that IBM with open source Hyperledger, that it will be a competitor? In other words, will not every country invent their own system, or do they their own research? And another question is also, is there interest in other countries for your solution?
I'll take the last part first. Yes, we've had interest in a number of other countries that currently in discussion with in terms of deploying systems. So the answer to that is absolutely yes. Would IBM or any of the other large IT firms that currently supply these centralized systems, would they potentially be competitors? I would presume yes. So we will have competition, but I would argue that our approach is unique, and I think we have a compelling story in terms of the number and types of use cases that we can deploy with any of the clients that we've outlined that would be potential users of platform and service.
Yeah, and do you have also, for instance, Solve.Care with your own network, the ability to enter or to have connections with within the administration of United States, for instance, that you can convince other people to, or the government, for instance, to participate in the projects? Usually, that is also a very good ISP, USP for you, that you get a very good selling point, for instance, or do you have other unique selling points that Solve.Care has above other competitors? Because the competition is always there, of course. But what is, in your opinion, the key benefit of Solve.Care that you say, okay, this is where we have the better opportunities?
I think we've laid out in all of our documents and what I've briefly discussed here today compelling use cases for a number of government agencies to utilize the platform and to deploy it. So the short answer is that we are in discussions with multiple agencies within the federal government as well as in U.S. states to deploy various use cases that I've outlined already. Some of those are fairly far along, and as soon as we have something in writing, we will certainly be announcing it. But there's a high level of interest across the federal government in terms of utilizing blockchain solutions to deal with many of the problems outlined, as well as many of the processes where agencies are clearly having problems with. I would suggest I did author a peer-reviewed journal article earlier this summer that lays out very specifically the use cases for the deployment of blockchain technology within the health information technology space. I would commend that for the review, and as a result of that article, I was asked to give a presentation at the Centers for Medicare and Medicaid Services by the Chief Technology Officer of the agency a few months ago, where in essence we outlined the use cases and how blockchain could be potentially deployed.
Okay. Another another interesting question. Actually, David, what do you think of the level of questions? I think it's quite high. The quality is very good. What is your
Okay.
opinion?
No, I thank you. As a professor, I welcome questions.
Absolutely. Pines also has it's stating that your goal is quite ambitious, and he states your goal is at 257 million US dollar, which would put you at par with the biggest ICO so far. I'm not sure if it's right, but uh, could you indicate the size of the core development team that you can deploy for this initiative? For Pete, it does seem that it's a quite ambitious project. Could you answer that
Yes,
maybe?
he's absolutely right. This is very ambitious. So, um, our approach is that our first goal is to raise the 25.7 million. That's our threshold, and we're we're actively pursuing investment. That gets us to the full deployment of the platform and to go out and actively pursue um, contracts as well as engagements with insurers and government agencies to deploy. For those of you that don't know, as an example, the federal government alone spends $25 billion a year on health information technology and administration of those systems. We believe we can make a compelling case to those that annually spend that amount of money to deploy and use our system. So we think that there's tremendous revenue opportunities for a company like ours in terms of utilizing the technology on a scaled basis. In short, we believe that the platform is infinitely scalable.
Yeah, if you compare it with what you told about how much has been has been spoiled annually in the healthcare system in the United States, then I think if you put it in perspective, maybe your goal is ambitious, but it's also relative. And is it not also an American saying? If you aim very low, you will hit it at it.
Hey, you're right. That's very good. I agree with that.
Yeah, and Kees de Ruiter, no, sorry, Kees van der Sluis says, what will be the investment, for instance, for a hospital to implement blockchain? Maybe it's a general question, but maybe you can point something
Well,
out.
that's actually an excellent question, and unfortunately, it's not on these slides I'm presenting here, but I'll discuss it very briefly. Um, you know, most hospitals, if they're a large hospital system, they are spending 10, 20, $30 million a year on their system. We fundamentally believe that the deployment of our technology, I mean, we can significantly reduce those costs. We argue at least in half. And more importantly than the reduction in the IT spend that a hospital system or an insurer would 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 do to deploy our system, they would get a lot more, infinitely more, I'd argue, functionality and transparency within their data systems, and frankly, more usability for the individuals involved by deploying our blockchain technology platform.
Yeah, and another question is that Luke from April says, do you have all the authorizations of the government? In other words, do you need them actually? Well, I think that you need the government behind you, that's for sure.
Uh, yes. So first, to talk about government, we have applied for. We expect to get our Reg D filing from the Securities and Exchange Commission. So we're uh, legitimate token investment, so to speak. So that's obviously important to us, and especially given the caliber of the board members that we have, that's important to them as well. Secondly, in terms of any regulatory filings or necessary documentation, that will vary by jurisdiction, but needless to say, we'll certainly comply with any um, requirements related to our business prospects.
Okay, thanks very much, David. We have 15 minutes left, more or less, for the webinar. I'm not sure how much time you need for these couple of slides you have.
Well, let me go through these remaining ones very quickly, and then I'll have a few concluding remarks. So this is in short the fundamental um, uh, enabling technologies associated with the platform. Obviously, built on the blockchain. Of course, smart contracts built on Ethereum would be um, part of that, in essence, relationship logic that I've outlined, as well as for data management, um, cognitive computing, the analytics that I've discussed, as well as, of course, cloud computing on the distributed node. So these are all of the um, platform technical components. I'm not going to go into it in any great detail, but we've got a technical white paper which outlines on the website as well. And again, same thing with the guiding design principles. The only thing I would note here in terms of some of the technical specifications, our core technology teams, and most notably my colleague and his Boyle, as well as Dean Barov, the technology officer, they have built $100 million plus systems for insurers, for government agencies over the last few decades. They're very skilled and experienced in terms of designing these systems. More importantly, we've got a very robust technology team that has done all of this in terms of dealing with complex systems integration. So our roadmap is also, I think, ambitious as well in terms of how we would use the capital from the token sale in terms of building out the system. So we would be able to launch various segments of the platform beginning next year and through 2018, 2019, and then everything really ramped up by the middle of 2020. So we have a very robust governance model associated with the platform in terms of oversight of the thing, as well as how product and product architecture is achieved. And again, we lay that out very specifically, and it's on the website as well. So these are some of the examples of our revenue sources, as well as uh, the description of those revenue sources, where it's going to come from, and what our assumptions are. And this is all based upon our experience. And again, we've got detailed revenue models on the site as well. So during phase one, these are, in short, our projections in terms of our monthly recurring revenue that through our phased approach, based upon these PMPM assumptions, as well as contracts that we think we can get, sign, and deploy within the community that I've outlined. So the CAN token is the utility token of the platform. And in essence, it's, as it states there, it's the gas that runs the platform. In short, clients need this CAN token to configure their networks. And they pay for the platform fees, wallet subscriptions, cards, and transactions by using the CAN token. So again, clients need these CAN tokens for platform transactions and services. And subscribers need the tokens to pay for subscriptions. So the CAN token holders are clients, insurance companies, employers, government agencies. Subscribers are CARE wallet holders and CARE card subscribers, as well as healthcare stakeholders, developers within the system, service providers, as well as obviously processors, meaning those that operate and run the nodes.
Yeah, and the subscribers actually, David, are patients, for instance? Subscribers?
They would be necessarily not necessarily individuals, but insurers.
Mm-hmm.
So, um, so this is again a summary of the CAN token holder rights in terms of platform licenses, network access, community membership, processing rights, governance participation. And of course, the CAN is designed, there's no profit participation because there'll be a fixed number of tokens. So the CAN, in short, is designed to grow in value as the CARE community grows, designed to grow in value as the CARE marketplace grows, and as there's greater platform adoption. And it's designed to grow in value as the number of transactions on the platform grows. Short, as the company grows, as we achieve greater scalability, given basic economics, we believe that the value of the CAN token will grow in value over time. So this is an example of membership requirements in terms of the number of tokens that will be need to access the various services, subscriptions, and fees on the network. So again, we've got all of this even more documented than I'm showing you here, again, on the website. So these are, again, some of the community membership requirements directly related to the CAN token, as well as bounty programs specifically related to for developers within the network as well. So this is a brief overview of the token sale. So the sale is currently, we're in pre-sale right now in terms of the number of tokens issued. The pre-sale price is currently 20 cents. And we've got our thresholds that I just went through. Again, the token sale outline, that is all on the website as well. So this is how the tokens will be distributed. As you see, the team and foundation have a reasonable, and for that matter, in terms of what I've seen thus far, small amount in terms of the total issuance of the tokens. Most of it is being offered for sale in terms of accredited investors who are token sale. So this is the use of proceeds that I think is reasonable and below most standards that at least I've seen today in terms of how we will use the capital in terms of the development of the program, the platform, excuse me, and how we would use it, I think, in an efficient, appropriate manner as a fiduciary. So that's a picture of my colleague, the CEO, Pardeep Goyal. There's his LinkedIn page as well, and that sort of concludes that particular deck. So with any time we've got remaining, I think we've got like 6 minutes or so. I'd be happy to take any more questions.
Yeah, thank you very much. So that you say that the pre-sale is at 20 cents now for one CAN token, and so it's already a 20% discount from the next step.
Correct.
Okay, this is very nice. And the CAN token, is it with the slogan "Yes, we can," or this thing, or?
That sounds good to me.
Yeah, but for me it sounds very interesting proposition actually, and we will also participate soon with this project with ICO, and the nice thing is that you don't need to use huge sums of money. You can do small, of course, and to distribute the risk. And also, but it is very important if you believe or if you think the principle behind it. It's very interesting. For me, this is Solve.Care is quite a interesting proposition. Because as we can see how bureaucratic the system is, medical care also in Holland, and how much costs it is it's being involved. But I would like to do a little test with kind of survey. I hope that it's I was trying to do that maybe for the participants. I try to do a little survey in the meantime. Is it interesting, this presentation? So that I will also put in the questions soon. And the thing is that I also created one before. So, and also if people have some questions still left, put it on the table. David is very willing to answer them, of course. And I have to say, very good interaction today. Also very interesting questions. And I would like to ask you another question, David. We met each other in Barcelona, but also in Amsterdam, actually, with the blockchain. Dutch blockchain day in Amsterdam summit, and also very nice assistant. What is the name of the assistant? Helrika? No, is Frederika was it? Yeah. We also put some interviews on our website. I don't know if you have seen our interviews, actually, David.
I put on. I appreciate that. Thank you.
Okay, of course. I will put one sentence more.
So while you're doing that, I would just commend anybody that's interested in our token sale. All the documentation that I've just described is all on the site in terms of our roadmap, our technical specifications of the platform, and obviously the background of all the management, as well as everybody that's serving as a board member um, for the Solve.Care Foundation. So I would commend you to look at that if you're.
Mm-hmm. Yeah, I'm running a little poll here that is interesting. Yeah, it's a very interesting presentation. And some say, okay, it's interesting. Yeah, it's interesting to have Solve.Care at the seminar. It's more than 25%. Also, some say that it's not that interesting. It's very interesting why it's not that interesting. But Palmira says also, how confident are you in percentages that is going to implement it, your proposition? Yeah.
Oh, I'm very confident that we will have insurers as well as government agencies utilize our product. So we have confidence. Again, why are we asking for money? Why are we doing a token sale? Pure and simple, to use the capital to scale the platform quickly. And I think that I think we can efficiently use the capital to do that to reach our revenue targets. That I think, given the amount of spend within the system, I think our revenue targets are realistic and achievable.
Mm-hmm. Okay, it's very interesting. And yeah, in general the survey is very good. I see that more than 1/3 says it's very interesting presentation. And also 22% of the people say that more than 1/5 says it would be also interesting to have this one member of Solve.Care at one of our seminars in the future. So maybe it's good to negotiate, David, what we can do also for our participants, for our attendees, maybe. How do you see that actually?
Absolutely. I enjoyed my time in Amsterdam. I'd be happy to come back.
Okay, so I will also put some I will also put some questions to the group, and maybe we can implement very nice, organize a nice seminar as well. And with your permission, David, I will switch a few seconds to into Dutch for
Sure.
kind of ICO day. What would be interesting? Ik ga heel even kort in het Nederlands terugswitchen. Om even aan te geven van, ja, is er interesse? We hebben een ICO-dag, crypto/ICO-dag in de planning. En we worden heel vaak gevraagd, ja, hoe selecteer je nu ICO's? Waar let je op? Zou het interessant vinden om ook handvaten aangereikt te krijgen om ja, valkuilen te omzeilen voor ICO's? Dat je ook first-hand informatie krijgt, bijvoorbeeld van ICO's, hè, van personen die komen praten over een ICO, of het nou in het buitenland is, zoals Solve.Care, of een andere interessante, zoals Guts tickets, zijn we ook mee achter de schermen mee bezig. En daarnaast die ICO natuurlijk wel belangrijk is, met bitcoins, ja, hoe heb je de boot gemist, wil je alsnog instappen, dat je ook met verzekerd bitcoins wilt kopen. En omdat dat we ook leren op een eenvoudige manier dat je binnen 1 maand 10% extra rendement op je bitcoins kan maken. En live traden natuurlijk op de dag. En ja, dus dat is even een vraag mijnerzijds. Ja, wat zou je qua interesse hebben? Mocht het opportun zijn, zo'n dag over ICO's, crypto trading. Wat zijn interessante topics? Dat je zegt, nou, dit vind ik gewoon wel zeer waardevol. Dus wat zou waardevol zijn voor een sessie? Yeah, I'm switching now into English again, David. Actually, you are in United States. Actually, yeah? 6 hours difference, if I'm right.
Right.
I put some question about crypto/ICO day. What would be interesting for participants? I've been to many meetups, for instance, Bitcoin Wednesday and these kind of things, and what they always noticed is that there were very big stories about solutions, but not about trading. For instance, how do you earn money with trading, or how do you earn with money with ICOs? How do you select ICOs? And I put some questions on the table that what kind of topics would be interesting for the participants. And I put some question, and Kees said also, yeah, one of our coaching clients, he also had started a kind of WhatsApp group about ICOs. Also in our on CryptoAcademy, we have also a special board dedicated on ICOs, and I will gather some input from the participants, and we, of course, we speak to many people on our seminars, and well, I think it's. I will wait a few minutes more and about maybe some other questions or contributions of. I see that it's a little bit quiet at this moment. Yeah, Kees says something else. He's typing. Very appreciated, actually, David, that you take time to explain the Solve.Care proposition. And it was very interesting. Appreciate that you attended this webinar also for our group. Okay, so it says yeah, Solve is long-term investment. Yeah, could be. I don't know. But if I look at the roadmap, then you see that if you enter early at 20 cents, you have a very low discount or a high discount, but a low entry level. Next, especially if the money of the token will increase. And I think there's also there's a good business model behind it. That the token can be monetized well with yeah, because the parties need subscriptions. They need to buy packages, and they need the tokens. Mhm.
Yes,
Look,
absolutely.
wat is WAH?
Yeah, so
Yes.
our goal, John, is to have this company be cash flow positive next
Yeah,
year.
yeah. That is also one suggestion. From my point of view, also with ICO, take a look at the business model. If and also that you told me one time before, David, look to which there are many ICOs, of course, but what is the solution the company is giving to the problem? Which problem is there, and what kind of solution uh, is being offered? It's very interesting. It's also a very important question, of course. Yeah. And in this case, I
Yeah,
think also Solve.Care is giving a very good solution to the big problem.
yeah, we've taken great pains in terms of what I've published, again, in academic peer-reviewed journals, in terms of outlining what the problems are, and they're fairly well documented in the U.S. specifically. And we've laid out very specifically how the use of blockchain technology that we're suggesting can help to solve those problems in a cost efficient and effective manner.
Mhm.
Frankly, that message is starting to resonate with individuals within government, within insurers that have to deploy and use these, multi-million dollar systems.
Actually, and also what is also a very important question, of course, how about the funding, the early investors? So Solve.Care is also angel investors entering early with big money already.
Yes, we're in discussions with numerous funds, family offices right now. So, yes.
Yeah, there's also a sign of strength, and also with the board, the founders, co-founders also investing themselves is very good. Actually, one I will put some two questions more. So one already is Luke van Eetveld is asking, what about Obamacare, about uncertainty? Could you say something about that,
Um,
about the developments?
I could say a lot about that, but in terms of the Affordable Care Act, it's still ongoing. Um, Medicaid expansion in the state is in place, which is a key element of it. Cures are still, serving those populations. They still have a need for systems to coordinate these cares. So it's somewhat irrelevant in terms of what happens with the political rhetoric in Washington.
Okay, I'm just waiting for one last question. Solve.Care. I will put finally in the chat the token sale, and I'll put here. Okay, Palmira is also typing. Solve.Care says token sale. That is about more information about the token sale. Mhm. Palmira Bakker asked the question: what is the investment range required? If I'm interpreting well. Palmira, are you meaning that how much money you need to put on the table to invest? Yes?
Right.
Well, that's
Yeah,
up to
right
you.
now, yeah, in the pre-ICO phase, again for accredited investors, not in the U.S. It's 20,000 US dollars, which would equate to 100,000 tokens.
Okay, but for instance, but the retail investors, like most of them are, it's you can do from 50 bucks down to several hundred thousand bucks. Eh? It's about up to the investor himself or herself. Is correct with the ICO. So there's not really a minimum with a retail investor actually.
Right now, I don't think so, but I'm not. One of my colleagues is handling that, so my understanding was that the minimum threshold in the pre-ICO phase was 100,000 tokens.
Yeah, okay, but now it is early adopter sale at this moment because
Right,
if you click on the buy
right,
can now,
right. Yeah, yes, you can. Yes.
yes you can. Yeah, no, but I mean if there is kind of minimum for these 20 cents already.
Um, I don't think so, but I'm not entirely
Hmm.
sure because I think that was changed by the team, and I apologize. I don't have a
Hmm.
answer for that. So I think it's on the website, but if there's questions, obviously they can contact me or through the website.
Yeah, and I also see something very important because Solve.Care is very good with know your customer,
Yes,
KYC.
absolutely.
You also put the documents, and is also very trustful as well. If you have the KYC in order as a company.
Yeah. So the only other thing I'm gonna mention, JR, is that in short, um, we are not fly by night, meaning we are in this for the long term, and obviously given the complexities and the very complex nature of healthcare in the U.S. especially, and really in any industrialized country, this is going to take time, and we're committed to it.
Hmm. Okay. Actually, thanks very much, David, for your time. Actually, and of course, we will keep
Thank
the
you.
lines very short. Thank you very much for your presentation. It was very clear, and I will listen to the attendees also sooner or later about about their findings. And but it was very interesting. I wish you a very good afternoon, of course. And I will put
Okay. Well,
also
thank you.
yeah.
Yeah, I appreciate your time. Yeah, I appreciate your time and everybody's attention during the presentation.
Likewise,
Thank you.
likewise.
Bye. Thank you. Bye.
Nou, dan zijn we tot het einde gekomen van dit webinar. Iedereen van harte, hartelijk bedankt voor de deelname natuurlijk. Ik hoop dat het waardevol is geweest voor jullie. De eerstvolgende seminar over crypto CQ ICO's zal 21 november zijn. Dat is op een dinsdag. Er komt nog meer informatie binnenkort op per e-mail. En mocht je interesse hebben, neem gerust contact op. En ook uiteraard degene die nog wat suggesties heeft voor een crypto ICO dag. Feel free om die met ons te delen. Palmira, uiteraard geen dank. Colim ook, super. Kees Ruiter, ook geen dank. En iedereen die nog in de room zit, Anja Smit, David Sanders ook. Heel mooi dat je ook aanwezig was natuurlijk. Kees Ruiter, Kees van der Sluis, Leon natuurlijk ook, Luc van Eetveld, Mark Brouwer. Iedereen hartelijk bedankt dat jullie langer dan 1 uur hebt volgehouden. En ik rond bij deze af. En super veel bedankt. En ik zie ook de eerste binnenkort natuurlijk op de base op Schiphol. Elke woensdag is ook een soort inloopdag. Dan kun je daar ook even kijken, een kopje koffie halen. Kom gerust langs en een prettige avond iedereen en tot de volgende keer.